Hepatitis B is a global public health threat and the world's most common serious liver infection. It is up to 100 times more infectious than the HIV/AIDS virus. It is also the primary cause of liver cancer, which is the second leading cause of cancer deaths in the world. Here in Ghana, its prevalence is around 12.3%, placing it as a highly endemic country. Dr. Felix Enieje is a member of the Ghana Association for the Study of Liver and Digestive Diseases and a specialist physician at the Techiman Holy Family Hospital.
Hepatitis B is very infectious. In fact, again, to put a figure to it, it is 100 times more infectious than HIV. And it is about 10 times more infectious than hepatitis C. So what it means is that if you have some contact with a patient who has hepatitis B and HIV, and the mode of transmission is such that you can have both, the chances are that you would have hepatitis B rather than HIV because it is far more infectious, about 100 times. So we have that influencing its spread.
He expressed worry at the fact that hepatitis B can be easily passed from a pregnant woman to her baby at birth and asked that enough attention need to be given to help prevent this mother-baby transmission.
Because a mother can give it to the unborn baby, we also have situations where a lot of mothers would have to be checked for hepatitis B, and then if they are positive, we need to institute measures to prevent the transfer to the baby. Usually you need to give some immunoglobulins to prevent the baby who has been exposed to hepatitis B infection in your bid to kind of prevent the infection from being transferred. Unfortunately, most of the mothers cannot afford because this is pretty expensive, and that in itself puts their children at risk, especially for the mothers who are positive for what we call the E antigen. They are even far more infectious, and this is something that I think as a country we should pay attention to.
The medical specialist, who is also the head of internal medicine at the Holy Family Hospital, conducted a research on the topic, Hepatitis B, the Ghanaian perspective. He wants health professionals to check their statuses as well as help in awareness creation to help minimize infections across the country.
Some health people are not aware, and surprisingly as it is, we have to keep talking about it so that everybody at least knows his or her status. The second bit to it is that we hope that these health people, after getting to know some fine details, can also go out there and propagate the message so that somehow they would also spread the word so that everybody out there will be aware of what is happening in the hepatitis B space and also try to do their very best to help curb this menace.
Dr. Felix Enieje admonishes the public to adopt lifestyles that will help protect them from having hepatitis B infections.
The first step is for you to know your status. You have to test to know or to confirm whether you are positive or negative. Now, if you are negative, then thankfully we have a vaccine that can, to a very large extent, prevent you or protect you from getting the infection. Again, after taking the vaccine, you have to also avoid all the negative lifestyles that can make you more prone to having the infection. So
he also cautions the public to stay away from self-medications as it has the tendency of complicating one's ailment.
So the advice is that you should be careful with self-medication. Not only for hepatitis B, but generally self-medication is something you want to avoid as much as possible. Because mind you, the liver also detoxifies almost every drug. So self-medication shouldn't be encouraged both for hepatitis B and indeed for every other condition.
Reporting for Joy News, Anas Sabit, Techiman.